This patient was referred to me for evaluation endodontic retreatment of teeth number 18 and number 30. This is tooth number 18. I'll show you tooth number 18 first. Patient goes to his dentist here in Sacramento, California, and the dentist says this root canal needs to be redone, and along with tooth number 30, and refers the patient to me. So the patient is already sold. He is sold on having tooth number 18 and number 30 root canals redone. So he comes to see me. I asked him, I said, okay, tell me about these teeth. Do they hurt? That's tooth number 30. Do they hurt? No, not at all. I have zero pain. I have zero issues, zero pain with these teeth. When were the root canals done? The root canal was done about 8 to 9 years ago. Where were these root canals done? In Ukraine. Okay, so root canals were done in Ukraine. That's a telltale sign. All right, so root canals that are done in Ukraine, in Russia, Ukraine, and the adjacent countries, they are done differently. So our eyes are trained to see root canals a certain way, the way they look on radiographs, to look a certain way. If the look of the root canal doesn't agree with our eyes, the way we're trained, then we think that there's a problem and we think that we should redo the root canals. Well, take a look here, for example. This is tooth number 30. You think it's all empty here, but again, remember, this root canal was done 8 or 9 years ago, and it was done in Ukraine. The way they do root canals in Ukraine and Russia and those adjacent countries is very different from the way we do it. They basically leave pulp tissue in the canals. They remove some of the pulp tissue, and then they use some kind of a paste. We call it Russian red, and they basically mummify the rest of the nerves. So the nerves are still there, but they're in a sterile environment, pretty much. So as you can see, this root canal was done 8 or 9 years ago. It doesn't look like, we're not used to seeing the root canal like this, but there are no periapical relucencies, and this patient has no symptoms. This is tooth number 18. Look at the way the root canal was done. Look how short the fills are. The end of the root is here, and this root is here, roots. And look how short. But these root canals were done 8 or 9 years ago. Patient has no symptoms, no periapical relucencies. I'm not going to redo these root canals. I told the patient, I said, we don't need to redo these root canals. And he was so happy. My goodness.